You may already be aware that urine formation involves 3 steps. Last time, we discussed the first step, glomerular filtration. This time, we'll talk about the other 2 steps, tubular reabsorption and secretion. Here are the learning objectives. After completing this session, you will be able to summarize the mechanisms of tubular reabsorption of water and solids, explain how sodium and water reabsorption is regulated. Let's continue with the story of Mr. Lin. He is diagnosed with nephrotic syndrome. His condition worsened in the past few years. Investigations reveal that he has dramatically increased serum creatinine, elevated serum potassium and phosphate, and decreased bicarbonate and hemoglobin. How did these changes happen? You will be able to explain all these abnormalities when we finish today's discussion. Kidneys have 2 sets of capillary beds. The glomerular capillary network is responsible for glomerular filtration, and the peritubular network for tubular reabsorption. Kidneys filter about 180 liters of plasma each day. More than 99% of the filtrates are reabsorbed into peritubular capillaries and returned to the circulation. The absorption depends on the specialized structures of the renal tubules. Renal tubules are lined with epithelial cells, which are specialized for tubular reabsorption and secretion. The cells lining each segment have a different outer structure, which determines their characteristic functions. For example, the cells lining the proximal tubule are endowed with a brush border of microvilli on their luminal surface with many mitochondria. This brush border dramatically increases the surface area and the capacity for reabsorption and secretion. The abundant mitochondria provide rich supplies of ATP for active transport. The nephrons are surrounded by the peritubular capillaries. Solids and water are returned to the peritubular capillaries by reabsorption. At the same time, a few solids are excreted from the blood through the peritubular network into the tubular filtrate. This is the so-called tubular secretion. Both tubular reabsorption and secretion involve 2 basic membrane transport mechanisms. It follows the same rule used by all other cells. You may wish to review these basic transport mechanisms discussed in Chapter 2. Most reabsorption and secretion take place in proximal convoluted tubules because the tubular epithelial microvilli offer greatly increased surface area. The distal convoluted tubules and the collecting ducts are important for water reabsorption. Tubular reabsorption is highly selective. Only those substances necessary for the body are reabsorbed by the tubular cells. Meanwhile, those unwanted substances, like metabolic waste, are not reabsorbed, and they are excreted in the urine. Therefore, By controlling the reabsorption of different substances, the kidneys regulate excretion of solids. Tubular reabsorption involves two pathways, paracellular and transcellular. Using the paracellular route, substances are reabsorbed through the intercellular space. It involves transport of substances from tubular lumen into interstitial fluid through the intercellular tight junction, usually by diffusion, and then from interstitial fluid into the capillary. The transcellular pathway involves substances from tubular lumen moving into the cell, from there into interstitial fluid, and then into the capillary. Tubular reabsorption occurs in almost all segments of renal tubules. Substances like glucose, amino acids, sodium, potassium, calcium, bicarbonates, chlorides, phosphates, urea, uric acid, and water are reabsorbed in the proximal tubules. Loop of hand is responsible for reabsorption of sodium and chloride. Sodium, calcium, bicarbonate, and water are also reabsorbed in the distal tubules. Waste products such as ammonia, creatinine, and metabolic wastes of medications are actively removed from the blood into the tubular filtrate and then eliminated in urine. A few substances like organic acids and bases, as well as potassium, are also secreted from the peritubular capillary blood into tubular fluid. Thus, in addition to filtration, secretion provides a mechanism for eliminating substances in the urine. Excretion refers to the amount of a substance excreted per unit time. Excretion is the net result, or sum, of the processes of filtration, reabsorption, and secretion. Tubular reabsorption is regulated by three factors: glomerular tubular balance, hormonal factors, and neural mechanisms. Glomerular tubular balance is one of the most basic mechanisms controlling tubular reabsorption. It is the intrinsic ability of the tubules to increase their reabsorption rate in response to increased glomerular filtrate. It helps to keep reabsorption of solids, particularly sodium and water, constant. For example, if the glomerular filtration rate increases from 125 milliliters per minute to 150 milliliters per minute, the absolute rate of proximal tubular reabsorption also increases from about 81 milliliters per minute to about 97.5 milliliters per minute, meaning the rate of reabsorption is still 65% of the glomerular filtration rate. Several hormones like aldosterone, atrial natriuretic peptide, ANP, and antidiuretic hormone, ADH, are involved in the regulation of tubular reabsorption. By changing reabsorption of sodium and water, kidneys help to maintain normal blood volume and blood pressure. Aldosterone from the adrenal cortex stimulates the reabsorption of sodium and water from the filtrate back to the blood. AMP is secreted by the atria of the heart when the atrial walls are stretched by high blood pressure or blood volume. AMP decreases sodium reabsorption in the kidneys. ADH is released from the posterior pituitary gland when the amount of water in the body decreases. ADH stimulates the distal tubules and collecting ducts to reabsorb water from the renal filtrate. How about when we take in excessive quantities of fluid? When the amount of water in the body increases, the secretion of ADH diminishes. So the kidneys will reabsorb less water. Urine then becomes dilute and more water is eliminated until the body fluid concentrations return to normal. Neurofactors, sympathetic nervous system promotes tubular reabsorption. It also increases the tubular reabsorption indirectly by stimulating secretion of renin from juxtaglomerular cells. Renin then causes formation of angiotensin II, which increases sodium reabsorption. This is the end of the first part of tubular reabsorption and secretion. Next session, we'll discuss the reabsorption and secretion of some important substances. See you then. Thank you.